guys, welcome to Caapid Simplified. I'm Leena, your mentor in DDS journey. Today, I'm here with a very special guest, Khushbu DDS, who is a D3 student at Nebraska Medical Center. She's a great person, believe me, and I'm thankful for her time to come back and guide you all in this process. And if you like our content and our collaborations, do subscribe to our channel and let us know through your comments if you're motivated or you need more information. We'll be more than thrilled to keep you updated with our content. So let me introduce Khushbu. Hi Khushbu, how are you?
Hi Leena, how are you? I'm good, thanks.
I'm good. How is your school going?
Right now it's really good, and day 3 year it seems like it's going well, and we are ready for D4 right now, but it's still 2 semesters left, and in the fall we will be in D4.
Amazing.
Hopefully.
You will be. So is it too intense, or are you going to school, or is it online right now?
No, we already started the clinic rotation, so now we have to go to the school. 2 months before our classes are hybrid, so some of the students needs to go school and some can able to attend it online. But otherwise now we have to go to the school for our classes. It will be like 3 days in a week for classes, and other times we have to attend the clinics. So I think for 6 sessions will be clinic for us, the morning, afternoon, like that.
Okay, so let's begin. So would you like to talk about yourself? I know you have recorded a video with Flynn and you have talked about it, but I would like to know you more personally, as in who is Khushbu? Forget about profile, achievements, and everything, but what's unique in you, and what makes you you? Like, where are you coming from? Your values, your culture?
Yeah, definitely. So I originally from Surat, Gujarat, which is in India, in more northwest side. And I am from a joint family, that is like extended family, we call it in USA like that. So I already belong to the extended family. We are always around with the people, and from where I learned all of my skills. And being a Gujarati, we like to make a food at home. We like to enjoy fun, games, all that kind of stuff at home. So yeah, they're all cousins and friends. They're always around me, and that's how I got all my learning and skills. So it was a little bit easy to learn from others and from the like loved ones. So that's how I got interested in the dentistry. There is no one from my family who is dentist, but
Oh,
I used to go with my parents to visit the dental offices, and then they are my parents' relatives. So that's how I got into the dental like interest, like what are they using, what materials they are using, and then files like endo treatment or anything. So
yeah.
then I was in my 12th grade, and my parents were thinking that I should apply for medicine because of good grades and all. They were thinking like that, but I am not. I was more into thinking in dental or something in skilled work, because my parents and my dad and my father-in-law, they are mechanical, they like to
Okay.
do engineering stuff. So that's why my surname says is engineer. In Gujarati, that means engineers. So my
Oh,
uncle is computer engineer. My dad is like he was repairing the TV, but then he got like he self learned everything, and then now he's doing a like CCTV camera circuits and all. So like electrical
that's
engineering stuff. And
that's super
my other
interesting.
uncle, he's a contractor and a civil engineer. So we have all the backgrounds coming in together in the one house. And my brother right now is architects, and I'm a dentist. So no one from the medical background, but I built myself in health profession.
That's
My
amazing.
grand,
So I
yeah,
never knew that you have a family identity with profession. So I can already see you are an empath. You are very humble because you are a family person. You are emotional. You can sense it. You know how to network, right? And then you
Yeah,
are
yeah.
artistic because it's in your blood. And did you visit your school town before getting accepted at the school?
Yes, for the interview, it was on site. So we did visit the interview and bench exam in the
And
town.
how did you like the school at that time? Like, did you visit around? How is the accommodation there? What kind of people, culture, and what it is famous for?
Okay, so when I started looking for Nebraska, it is a Cornhusker state, it says.
Mhm,
So here is a world largest corn like productions going on,
mhm.
and it's kind of a flat land, all the like everywhere. And New Hampshire is very northeast east
Mhm.
location, which has mountains and valleys and everything. So
Okay.
the whole geography is a little different in Nebraska, I would say. And I didn't even expected that they get some student from the northeast area, because Nebraska is Midwest,
Yeah.
right? But I still thought that this is a really great school, and I should apply here. And then Nebraska is in Lincoln, and in Nebraska, two cities are very famous, Omaha and Lincoln. And
Okay.
our school, dental school, is in the Lincoln.
Okay.
And here, the people are like really welcoming. They are compassionate, empathy, and everything I get. And in at the day of interview, the director was very welcoming. Like, I didn't even feel like that I'm in a strange place, or I need to ask for this thing. They have everything in the day of interview, and they make you comfortable for before the interview start. They give us lockers to put some stuff, and they asked us to you can talk with the other regular students for the process. Then they started our interview,
So
and
can
they
you
give
talk
you
a
the
little
whole.
bit? Mhm. So can you talk a little bit about how your interview went and what sort of it is? Like, is it open file or closed file?
It is open file, I would say, because they had all your SOP and
Documents.
your resume. So they will ask from them.
Okay.
It's not like asking, they just wanted to know you, and that's why they're opening your SOP and resume to talk to
Yeah.
you. So that's
So
why they were like asking how many what was your dental assisting experience, what do you like uh, about the USA, or
mhm.
study here, all that. And
Basically,
they
they want to know
they
you
told
as
you.
a person, right?
Yeah, I think
Mhm.
they put you in the they are two rooms, and two faculties, two or three faculties in a particular room, and they one student will go in, and they will start asking you questions, and it will take 5 to 10 minutes for them to talk to you. And the next room, they will ask you about your general life, like what do you like to do if you choose to come to Nebraska, what are the things you can do, and how you can merge yourself with Nebraska people, like that.
Mhm.
Like, if you are, I like to plant, so they will ask, okay, there are some places you can plant. I like to go to temple, so one of the faculty said, yeah, there is a temple here near in Omaha, so you can go visit them, like that. So they make you really comfortable, and relate to your from where you are coming, and then how you can be here as a student, and you can be successful.
Does it also have clinical aspect, Khushbu, like radiographic interpretation or diagnosis?
No, no, there is nothing like that, but they ask you to write something about your I think 100 sentences, or I think 2 or 3 sentences about why you choose to come to Nebraska, or what is your purpose or objective for applying to dental school.
So that takes me to the question, what did you write? And why did you choose Nebraska?
Okay, so I choose Nebraska because of its academic curriculum. I like to learn digital dentistry and like to expose myself more with the digital and a new experience. Right now, I feel like other schools are also doing a great job for encompasses the digital world in the dental career. So I think that is a good. That's what I heard about Nebraska back then. And other than that, the small class size. I don't want to be in the class of 100 students or more, that where I cannot ask any questions, or I cannot be someone that if I don't know, I don't go and ask, or no one noticed me like that. So that's why I chose like, okay, small class size would be great to learn and very to be close to the faculty to know what their habits are, what their skills are, like that. And that's why
So you are 7, right, in a batch?
we are 6 students.
Okay, 6. And how diverse is the
Yeah.
batch? Like people are freshers or they have clinical experience, research experience? How many
So
from
this is really a new program in Nebraska. They used to do this program back in like 10 years back, but now they started. Ours is a second batch.
Okay,
So the first batch who came, they are from I think one is from Brazil, one is from India. So they just took 4 students back there in the
okay,
first batch, and then the
okay,
second batch they got 6 students. So
yeah.
they did increase their student ratio
Mm-hmm.
for advanced students, but the regular batch is 50 students.
Okay,
So
got you.
ours we are only 6 students to merge with the rest of them.
Mhm.
So then our batch is more, I think, two, three Indians, two Pakistani, and one is Egypt. And
Okay.
the new batch who comes here for the like third batch, they are more. They are also diverse, like Indian students, and some of them are, I think, Middle East. So they try to merge Middle East and Indian. Like they also know that some of the students also needs to be like gathered with the community, and their regular batch is also a little bit diverse, I would say. The regular
So
batch, yeah.
so it is an integrated batch, right? You guys move on with the regular batch.
Yes,
You are
yes,
merged.
yeah.
And how,
We are not different group. We are with the same group.
and
Yeah.
how many are in the conventional program?
Conventional program is 50
The
students.
regular program, the DDS,
Yeah,
like
yeah. 4-year program. Yes, 50 students.
50. Okay. Okay. I think that's still a reasonable class size,
Yeah, yeah.
which is good. Yep.
They
Okay.
have a pretty good preclinical lab, and it is 24/7 open. You guys can come and practice anytime. We have digital studio, and all the advanced tech like CEREC machines or trios, we used to use that in clinic as well as in the preclinic. If someone likes to know something about it, and they can reach out to faculty and get some more videos to learn and all.
That's nice, actually. Do you guys get to place implants or Invisalign or
Right
all that?
now, we don't have requirement for placing the implants. But if somebody like to know the research, like to do the research, or we have a post graduation perio, operative perio, ortho. Like some of the we have 3 or 4 post graduations, so you can go and assist them to, and you can also learn how to place it. But there is not particular requirement to put the implants. But yeah, there is a requirements for prosto, like a restorative of
Crowns
component of,
and all. Okay.
no,
That's nice.
implant restorations.
Oh, okay.
Implant,
So
yeah. So once we
crowns
get the
and
patients
abutments.
into the implant, and now we need to make a crown for them. But we do have implant course and digital dentistry course in our curriculum.
Okay. And how well does the DDS students basically merge with postgraduates? Is it like open, whatever you like, you can go and explore, or the program is so intense that you don't, really find time to go and assist them?
Yeah,
How
but
nice.
we definitely get time to visit them, and they're in the same building. That is a good thing. So
Yeah.
whenever we seek to get reference from perio department or ortho department or any other departments for the consultations of our patients, so we can call them anytime during our clinic sessions. So that is a
Mm.
good thing. So if I am doing a comprehensive exam and I see that there is a faulty root canal, I can go ask the endo faculty or resident to come and look at it, or I can show them a radiograph
And
that
amazing.
what you are thinking. So that way we don't lose the time for the patient, and we will have a like a final treatment plan what we can do, and we can collaborate that with our postgrad and the um, undergrad students.
That's awesome. I would say that's a very key, platform to give to candidates because you want to explore all paths, right? Especially being an international, when you have learned everything, you want to explore more and more and learn more. So that's good that
Yeah, and
Nebraska.
even our faculty of like we used to use the microscopes. So
Mhm.
our faculty inspire us or motivate us to use that during our endo sessions. If you because we are advanced and we have done a lot of endo treatment or extractions or anything, so they already know that how much capacity you have to do the endo. So now you know how to do the incisors or anterior teeth endo. Now it's a time to do some microscopic endo if you like. So if someone interested, then they can teach you how to use a microscope as
Yeah, that's nice. And what about your bench experience? How was it? How long is the session and what all do they ask in bench?
well. I would say it's a 3 to 4 hour session, and they asked us to do the zirconia
Mhm.
crown prep, and class two restoration on the premolar, I think, on the
Mhm.
maxilla. Yeah, but I don't know how they choose the tooth next year, but they usually ask gold crown or zirconia crown, and
Okay.
class two amalgam preparations. No
Okay.
composite, amalgam prep.
Okay, so it's intense.
Yeah.
So is it like so I know Nebraska actually starts very early.
Mhm.
July, I think you get your interview done, right?
Yes. No, no July. Yeah, they start this year early, but for us it's a September, and we joined in. So I got acceptance in October.
Okay, so this I think even this year, 2022, their deadlines will be early, right? And they send the
Yeah,
first batch in July.
yeah, they're trying to get early. Yeah.
So do they have interview and bench on the same day or it follows each
Yes,
other
yes,
on the same day?
yes. But they divide the students in 2 days.
Batch. Oh,
So I
okay.
think they don't call too many students. They just call 30, 40 students, I would say. And they divide them in a 1 day and a 2 day session. So one
Okay.
day they call 15 students or 20, depending on the size, and then they call the students on the other day. I would say first come first serve. So
Yes.
try to get the first day spot as if you are really interested in applying to Nebraska. And they also suggest that as well. So once they caught up with all the spots, then they don't get too many on the same day.
Yeah, got you. And
Yeah, and
did you
they,
take?
they prefer on-site. They prefer on-site interview and bench exam. They don't do virtuals. So because they
Yeah,
also wanted to know the student, and they also wanted to show the student how this community and the college is like. So they would
yeah.
also get more idea.
Do you recommend any bench prep course for the candidates who, are preparing for it, for Nebraska especially?
Yeah, if someone doesn't have any background about how to prepare, like yeah, we learn from our dental school, but which is totally different. I don't say the fundamentals are different, but the skill that they gain from the school is different than the US dental school. So try to get exposed to someone who knows the fundamentals, what they are looking at in the USA. I got the bench exam like bench course from International Dental Center, which is online. But now there are many platforms that you guys, there is one in Caapid Simplified as well that you guys
I
can
made it myself.
contact to. Yeah. So during that year, I wouldn't want to. Don't want to go to the in-person class because I thought that 1 week practice and then I don't get any recommendations. What I'm doing, I'm keep doing the wrong thing, and until I get someone's reference, right? So that's why I chose the International Dental Central program. It has a like you can post your pictures and your prep one day at a time, and you get the really good like
Feedback.
suggestions from them. Yeah, and that's why
Yeah.
I
Even
selected
I
that.
feel that ways online courses would help better, especially to the candidates who have no experience, right? So they are starting everything from new, because one-to-one, the more one-to-one touch you get, I think the more you excel.
Yeah.
So that is easily feasible in online course. Obviously, I cannot, teach people for more than 7 days because it's a headache, it's a lot of work.
Yeah, and if
Yeah.
someone is close to the dental school, they can contact to the students there, and they have some modules to follow. You can
Mhm.
ask them
Okay.
uh, that what kind of class two preps the schools are wanting, and what the depth they want, or what the
Mm.
basically they
The-
just want some 5 or 6 points that they need to know or need to see in the bench prep. Like class two amalgam, they need to see the clearance, they need to see the angle, they need to see the depth and the smoothness of the prep. So that
Mhm.
thing you need to master. Yeah.
That's a great insight because many people don't disclose the criterias, right? But Nebraska is very, clear in what they want. So
Yeah.
that's actually good.
Yeah,
And do you?
they actually give you the whole paper, the brochure, before coming to the interview and bench exam. They give you the criteria, how much depth and how like what are the
Oh,
things they will gonna look for. Yeah.
that's good. So you already know what all points you will be judged on, right?
Yes.
So
Yes.
that's good.
And you
And
can,
can
and sometimes you guys, if you got the interview call, and you can contact to the students from the same school saying that I got the interview and I have a bench exam coming. If you have some suggestions for me, can you please help me out with this bench exam prep or something?
okay.
So they will
Oh,
definitely love to help them.
yeah, okay. And do you recommend candidates asking for feedback, like if how did they perform an interview or bench through email?
Yeah, you should not ask how it went. Personally, I feel like, but you can just say appreciate their work or appreciate the time that they spent with you, and just a words of goodness and humanity. That's it, nothing else. You shouldn't be asking how was the interview, do you like it or not, because no faculty would want to share that thing, I feel. But you can definitely say thank you or appreciate their time and for calling you over that school. Yeah.
That's nice. So, do you recommend sending updates through the process? Suppose I submitted my application and then, I have improved my TOEFL score. So, do they entertain those emails?
Yeah, they definitely does that. And if you feel like I didn't get into this cycle, then you can definitely ask them, and then they can give you some suggestions. They are pretty good. I think Nebraska is pretty good saying that, giving you advice what to do next year, and they can happy to assist. And this year we have like mixture of the students. Some of them graduated early, some of them recent graduate for our batch. This year they got most of recent graduates. So
Oh,
they doesn't want, because they know they will gonna teach you guys how to work as a dentist. So
yeah.
they don't worry too much about how much experience as a dentist you have, but they just wanted to know what education you gather from your country.
Yeah. Yeah, I think that's true for most of the schools because they want flexible candidates. That's the,
Yeah.
I think, most huge requirement because they want you to learn, they want you to adapt, right, in the system. So, Yeah, I think Nebraska is a great school to consider. Guys, if you want any other
Definitely.
information, do write in the comment section. We'll be happy to help. And Khushbu, awesome insights. I'm so glad you found
Thank
out time
you.
and, come here to guide our viewers. Would you like to give any last moment tip before they are applying to Nebraska?
Applying to Nebraska, to any school in the USA, be patient first of all. Don't be hurry. Like I want to get in my first cycle. Don't worry, you will definitely gonna get. Don't stress out. And there is no point thinking about that thing because that is not in your control. First of all, so think where you can improve yourself. So think about your profile, think about what you can do other than what you have done in the past. So just think about that things and apply early if you can.
Mhm.
I miss that. So if you have some of your dream schools and you want to apply, just gather all the information from that school. Otherwise, everything's would be great, and you guys will be in the school pretty soon. So don't stress out about it.
Yeah,
Yeah.
even I feel, guys, just hang in there, keep moving, don't quit. Okay, success is not never failing. Okay, but
Yeah.
rising each time you fail and fall. So you will make it for sure. We did, and you are no different. And keep tuned to us for more content and videos. See you again. Bye bye.
Thank you. Thank you, Lee.
Sure, sure.